Hello and welcome to the Spotlight on Food and Health Communications. Victor Wabery is my name. Today is the second series of the trauma topic, and we want to go from childhood trauma, as we understand that research indicates that children are especially vulnerable to trauma because their brains are still developing. Children experience a heightened state of stress during terrible events, and their bodies release hormones related to stress and to fear. This type of developmental trauma can disrupt normal brain development. As a result, trauma, especially ongoing trauma, can significantly affect a child's long term emotional development, mental health, physical health, and behavior. The sense of fear and helplessness may persist into adulthood and leaves the person at a significantly higher risk of the effects of future trauma. Now, let's talk about the treatment. As we understand that several treatments can help people with trauma to cope with their symptoms and improve their quality of life. Let's start off with the first one. Let's talk about therapy. Therapy is a first line treatment for trauma, and ideally, an individual will work with a trauma informed or trauma focused therapist. Types of therapy a person with trauma could benefit from include cognitive behavioral therapy. When we talk about cognitive behavioral therapy, the CBT known by some persons, we talk about it comes from a perspective where it helps people to change their thoughts patterns in order to influence their behaviors and their emotions. Evidence supports CBT as the most effective approach for PTSD. Next up is eye movement desensitization and reprocessing. Eye movement desensitization and processing, or EMDR, is another common trauma therapy. During EMDR, individuals briefly relieve specific traumatic experiences while the therapist directs their eye movements. EMDR aims to help people process and integrate traumatic memories. Several randomized controlled trials have demonstrated that EMDR is an effective treatment for PTSD. Somatic therapist. Some therapists use somatic or body based techniques to help the mind and the body process trauma. A review of the literature in the Psychotherapy and Counseling Journal of Australia found that body based therapies could help a range of people. These therapies include number one, somatic experiencing. This approach involves a therapist helping a person to relieve traumatic memories in a safe space. Number two, sensomotor psychotherapy. This type of therapy combines psychotherapy with body based techniques to turn traumatic memories into a source of strength. Number three, acupoint stimulation. This involves a practitioner applying pressure to specific points on the body, which induces a state of relaxation. Number four, touch therapies. Other touch therapies include Reiki, healing touch, and therapeutic touch therapy. At present, there is not as much evidence to prove that effectiveness of somatic therapies as there is for CBT and EDMR. Researchers note that more data on this method would help to determine how they work. Now let's look at the medications that apply to this. Medication alone cannot cure trauma or PTSD, but it can help a person manage symptoms such as anxiety, depression, and sleep disturbances. A person should talk to their doctor about their options. Let's start off with the first one, self care. Practicing self care can help individuals to cope with emotional, psychological, and physical symptoms of trauma. Examples of self care for trauma includes exercise. Trauma can activate the body's fight or flight response. Exercise may help mitigate some of these effects. Research suggests that aerobic exercise may be an effective therapy for people with PTSD. Individuals can aim to exercise for at least 30 minutes a day or most days of the week. Number two, mindfulness. Mindful breathing and other mindfulness based exercise can ground people in the present, which can stop them from reliving the traumatic events. Studies suggest that mindfulness based treatments are a promising intervention for PTSD, whether alone or in conjunction with other treatments. Connection with others, withdrawal from others, is a common symptom of trauma. However, connecting with friends and family is very, very important, as we understand that according to the Anxiety and Depression Association of America, staying in contact with people can help to prevent trauma from becoming PTSD. It is not necessary to talk about the trauma with other people if it's too difficult. Simply engaging with others can improve mood and well being. Some people feel a benefit from disclosing the trauma with people they trust. Number five, a balanced lifestyle. A person with trauma may find it difficult to relax or to sleep well. However, sleep, relaxation, and diet all play a role in mental health. If possible, a person should try sleep for 7 to 9 hours every night. A person can also try to eat a balanced diet. A person should also avoid alcohol and drugs. You could also try relieve stress with mindful or enjoyable activities. Now let's look at some supports if necessary, because people can ask for support from others. This includes talking to trusted loved ones or joining a support group for trauma survivors. Now the next question: when to seek help. People who experience persistent or severe symptoms of trauma should seek help for mental health from a mental health professional. It is especially important to seek help if the trauma symptoms interfere with daily functioning or relationships with others. Even those with mild symptoms can feel better once they've talked to someone. Suicide prevention. If you know someone at immediate risk of self harm, suicide, or hurting another person, number one, ask the tough question. What's the tough question? Are you considering suicide? Number two, listen to the person without judgment. It's very important that you do this. Number three, call 911 or the local emergency number in your community so that you can communicate with a trained crisis counselor. Number four, stay with the person until professional help arrives. Do not leave them to wander around. Number five, try to remove any weapons, medications, or other potentially harmful objects around them. If you or someone you know is having thoughts of suicide, a prevention hotline can help. Reach out to the nearest hotline in your community, your local community, wherever you are, and seek help from counselors or health practitioners or those who are concerned with traumatic experiences such as this, to get help as soon as possible. I want to believe you've learned a thing or two on this series of trauma. Till I come your way next time, my name is Victor Waber. Keep staying safe.